going on, everybody? Welcome to Ageless Intimacy with Dr. Mia and Joseph. How everybody's doing today? I am Joseph, your male intimacy and health coach, and this is Dr. Mia.
What's up, y'all? It's Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology to women and adolescents with a focus on holistic and traditional treatment options, as well as hormone pellet therapy, weight management, total wellness with supplements, intimacy services, and laser hair removal for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. And we are super excited to be here today because what we're talking about today, Joseph.
We're talking about weight management and intimacy, how weight affects your intimacy, ageless intimacy. Yeah. So weight management, intimacy. So the one thing that we do know when it comes to your weight management, how it affects your health. And one of the ways it affects your health is when you gain weight, you have a more of a risk of having diabetes, heart disease, cholesterol is just something that we can have, period. High blood pressure, that's something we can have, period. But you increase your risk of getting it as you gain weight. And as you get older too, your blood pressure does change, because I know mine has changed over the last 2 years. But how does it affect your intimacy? So one of the ways we know it affects your intimacy, if you have diabetes has everything to do with your blood flow. So is heart disease has everything to do with your blood flow. And we know in order for a man to get a good erection, you have to have good blood flow. And also for a woman to have a good arousal and also have sensitivity, she also has to have good blood flow. So as you gain weight and you're trying to manage your weight and lose weight, I know I have seen an increase in blood flow as I've lost weight, And but I'm gonna go into the things we also do for the blood flow and things like that. But for you, Doc, what are some of the things you've seen, at least in our practice, as well as in just in the community, weight management community, have you seen that has affected people when it comes to when it comes to intimacy, and it comes to their weight management, directly related to their weight management?
Good question. So definitely people who exercise and maintain a healthy weight are less likely to have, like Joseph said, high blood pressure.
Right.
They're less likely to have heart disease. And when you think about heart disease and high blood pressure, you also have to think about peripheral vascular disease, which is totally blood flow and not having enough blood flow to even get down to the extremities. So people start noticing the swelling in the legs and the feet and the lymphadenopathy and all of those things. With more weight management, again, with exercise. So when you have good control of your weight, you're maintaining a healthy weight, you tend to be eating healthy and exercise. And those are two major requirements as you age.
Right.
So that makes a big difference. You are able to move a lot more. Other things that just affect weight and blood flow is age. Like, you can't control that. Hopefully we are all going to get older. But as we get older, blood flow does decrease, even if you don't have high blood pressure or heart disease. Things just don't flow as well. But definitely controlling blood sugar, cholesterol, blood flow by making sure you have good heart and cardiac activity and health. Making sure you're keeping your blood pressure in a normal range so you're not likely to have a stroke, which definitely affects everything. And then making sure that if you have diabetes, you're controlling your blood sugars and you're keeping your hemoglobin A1C down to minimum. Like, the goal with diabetes is you can actually cure diabetes with simply weight management alone.
Right.
So I tell a lot of my patients, you have this hemoglobin A1C, you're starting to go up. It's at 6 now. So you're in that pre-diabetes range. Well, if we could go ahead and get this down, that's going to be through weight management. So once you lose about 10% of your weight, your hemoglobin A1C is going to improve. Most of the times your blood pressure is going to improve. Most of the time your cholesterol levels are going to improve. And the blood flow is going to improve, because when you're exercising more, the blood flow improves. When you're hydrating better, the blood flow improves. And when you're healthier without the high cholesterol and all of those things, it's going to improve your blood flow as well. So living a healthy lifestyle makes a huge difference. We can't control the aging component, but we can control our numbers, knowing what your blood pressure is. If it's high, taking medication to help control it.
And so I don't know if this is a fact or not, but I just know in some cases that the older we get, the easier it is to gain weight if we're not consistently working out and eating properly.
Right. And even if we are.
Yeah. And also, it's easier we can keep the weight off even if we're not eating properly, but eventually that catches up.
That's right. And we were just talking about this with Jamil, my son. He was like, well, it's really 90% what you eat and then 10% exercise. And I'm like, yeah, you're right. That's exactly what it is. So it's all about what you're eating, like making sure you're cooking at home. Like that's what we were doing before we started this, is trying to meal prep for the couple of days that we're going to be here to make sure we're not eating out all the time. We're eating chicken instead of beef and pork, and we're baking it instead of frying it. We're still seasoning it up with a lot of vegetables and making sure we have a lot of vegetables and minimizing the carbs. So all of the small things that we can be doing for weight management, and then making sure you're eating frequent small meals, because one big part of weight management with age is the change in hormones. So it always goes back to, testosterone declines causing andropause and perimenopause and menopause in women, andropause in men. And when testosterone declines, it decreases blood flow because testosterone is actually a vasodilator. So naturally, it increases blood flow. Testosterone also is going to help you to sleep better. If you're not sleeping well, you're not going to lose weight. Sleep is a huge part of your wellness that is required for healthy weight management. If your testosterone levels are low, you're not holding on to muscle. And when you lose muscle, it's replaced with fat. So your metabolism decreases, and it makes it much harder to lose the weight and keep the weight off. When your testosterone is low, you may be more moody, more irritable, more anxious. That can affect emotional eating. So many things with aging naturally that can cause problems with your weight and make it more difficult to lose and maintain a healthy weight.
Right. So we're talking about weight management and intimacy and how weight affects intimacy. And a couple of things we just said was, as you gain weight, you can contract, right? Diseases that will restrict your blood flow. And to have a good sexual function and sensitivity, you have to have good blood flow. So that being said, what are some of the things we should pay attention to in our weight management? And what I mean by that is, how are we paying attention to our weight? At what point in our weight gain should we be concerned with gaining weight? And also at what point in our weight gain should we say, hey, I probably need to go to the doctor? Or what are some of the symptoms we need to pay attention to say, hey, let me go to the doctor and get this thing taken care of?
So you asked me a bunch of questions. What was the first one, baby?
At what point in our weight gain should we be concerned?
Okay. And how are we monitoring our weight? Okay. So monitoring the weight first, I was thinking about getting on the scale. So a lot of people don't want to get on the scale. So they don't know that they're gaining weight because they don't weigh regularly. So I think number one is weighing yourself regularly first thing in the morning before you eat or drink, after you use the bathroom without clothes on. And that's a consistent way to weigh yourself so you can see if your pounds are dropping or if they're increasing and it's on the same scale. So I think weighing yourself is very important. And what was the other question?
At what point should we say, or what are some of the symptoms we should probably pay attention to when, let's say we gain 35 pounds.
Okay.
Because it's real easy to gain 35 pounds and not really pay attention to it, right?
Right.
And let's say we gain 30 pounds and now we have some symptoms that we're not paying to, but we probably should be paying attention to these symptoms.
Okay. Good question.
And say, hey, let me go get this weight under control, or let me go to my doctor and see what I need to do here.
So I would say one is more headaches. A lot of times if you gain that much weight, your blood pressure increases significantly. And one of the signs of elevated blood pressure can be more headaches, more swelling in your ankles and your legs, feeling more tired all the time. Another thing that you should think of is if I've gained 30 pounds, well, what's my hemoglobin A1C doing? And how is my body metabolizing sugar? And are my insulin levels high? If you're having other symptoms associated with it, like night sweats and hot flashes, then you know if it's 30-pound weight gain, you need to definitely have your hormones checked too. If you're not sleeping, you're gaining weight, your sex drive is decreased, you're tired all the time, you're moody, you can't focus and remember. So now we need to look at hormones and our female and male hormones, so testosterone, estrogen, and our FSH, which tells us, you know, if we're in menopause or not, if you're a woman. We also need to look at thyroid. So some of the symptoms associated with that, when your thyroid decreases, is one of the most common causes of thyroid disease. It's Hashimoto's thyroiditis, runs in families. So if your parents or siblings have a history of hypothyroid disease, getting that checked as well, because some of the other symptoms that go along with that is cold hands and feet, hair shedding and thinning, dry, brittle skin, hair and nails, weight gain, decreased focus and memory, you know, significant fatigue, significant weight gain, difficulty losing weight. When you're insulin resistant, like I said, or pre-diabetes, it's harder to lose weight, easier to gain weight, especially in the abdomen. And then when you're starting to get all of those problems with blood flow, then you have to also look at cholesterol. You may not have symptoms with high cholesterol and high blood pressure. You may not have any obvious symptoms with diabetes, but once you have started to gain this weight, whether you're having these symptoms or not, go and be screened. See what your numbers are looking like. And if they are getting higher, you know it's time to do something about it, because we don't want to simply have diseases that we can control if we just lose the weight.
Right.
And losing the weight is not easy. You know, it may require some hormonal balance, some accountability, some coaching, some major lifestyle change. But the good thing is that everybody's interested in weight management, because we understand it is one of the most preventable causes of death. Obesity, being overweight, that is a preventable cause of death, and it's becoming the most preventable cause of death. The number one reason that people are getting more heart disease and having more strokes and, you know, getting more cancer, all of those things, all that extra weight negatively affects your risk for heart disease, high blood pressure, and not even just that, but like cancer, chronic pain, back pain, fractures, because you're larger, like so many things are affected by the weight, and your aging is going to change if your weight is much higher. So the closer we can get to normal weight, looking at BMI, not just looking at how we feel good or how we look good in our clothes, but making sure if you're a woman, your BMI should definitely be under 27, should be a goal. We say that it's normal weight when it's under 25. My goal is under 25, but at minimum under 27. And for men, I say under 29. And normal to me for a man is like 27 or less. There are those men who may not have as much muscle mass, and they can be closer to that normal range. But I'm not saying that you're supposed to be 100 pounds more or 20 or 30 pounds more. That's a difference of about 10 to 12 pounds based on your muscle mass. If you're starting to notice the weight gain, you have to start thinking about what chronic disease is this causing, because one of the most preventable causes of death, besides smoking, is obesity and being overweight.
Right. So now, we're talking about weight management and intimacy and how weight affects your intimacy. So now we've gained some weight. We got some symptoms. We're not getting the blood flow in the areas we wanted. We lack in the sensitivity. And now on top of that, these are all the physical things. Now we also have to deal with the emotional and the anxiety of, I don't know if it's going to work tonight. Right. So how do we deal with that, on top of the physical part? The physical part is one thing, but the mental and anxiety part is another thing. So how do we deal with that?
So, treating mental health. So making sure you have a therapist so that you can talk to somebody and you can, acquire better coping skills and stress control and stress relief, because stress causes heart attacks and heart attacks cause death. I mean, stress can negatively affect your health.
Well, stress causes disease.
It causes disease. It decreases your immune system, so you're more likely to get infections or cancer or autoimmune disease. I had to take my medicine today, so my what was I saying? I'm sorry.
Next question.
Yeah. So what was I saying for real?
No. I said, how do we deal with the mental part when, we've gained weight and we're still trying to be intimate with our partner, and, but we've been having issues in the intimacy part just because we don't have good blood flow because of whatever is going on with our weight and health and everything. So the question was, how we deal with the anxiety of it, and the emotional and the mental part of it, and you kind of answered that.
Yeah. So seeing your therapist, finding a therapist, understanding that therapy may be necessary for a lot of people, especially in this stage of life when so many other things happen and you have different stressors in this 30s, 40s, 50s, 60s age group. Making sure you're exercising. Exercise actually helps with anxiety and depression. Right. If you go see a doctor,
and exercise also helps with blood flow.
It helps with blood flow. Right. And if you also are seeing a doctor and your neurotransmitters are just like your hormone, you may need hormone balance and testosterone replacement to help your mood. You can also need neurotransmitters like, Wellbutrin or Lexapro or Zoloft to actually help with your mood. If you are significantly depressed, if you're significantly anxious and it's affecting your quality of life, you may need medications to help you with all those things. So the mental component, thinking about what medications you are on and can those negatively be affecting your intimacy too, as well as your appetite. So if you are on some of the antidepressants, they may decrease your desire for intercourse more and may increase your appetite where you're gaining more weight. There are a few out there that are known for significant weight gain, which is worsening your health. You know what I mean? So looking into the hormones, looking into the thyroid, all of those things being off can negatively affect your mood. And in order to have good intimacy, a lot of people need some help with mood stabilization that just kind of changes with the change of hormones, neurotransmitters, age, and weight.
Okay. All right, good. So far, just to recap, weight management, we're talking about weight management and intimacy, how weight affects your intimacy. And just to recap, some of the things that can happen when you gain weight can be, you can get a disease, you can have some emotional issues behind it. If you're trying to be intimate and everything's not working properly. And this is for both men and women because the blood flow runs both ways. It's not just, if you're lacking sensitivity as a woman and you're having a hard time, just really enjoying it, then that's something to be addressed.
And dryness, for women with low blood flow, it can cause more vaginal dryness and discomfort and like you said, decreased sensitivity. So it's not as enjoyable. And then if your hormones are down, that can cause a decrease in your desire as well for both men and women.
Yeah, and if you're lacking sensitivity as a man, that can cause you not to finish. Some people say, "Oh, you finish early." No, you can end up not finishing. Because you don't have the sensitivity to give you the option to finish. You can end up not finishing. Again, we're talking about weight management, intimacy, how weight affects your intimacy, and just like I said, and dealing with the mental part of it as well. First addressing your symptoms, addressing the weight gain, then if it continues beyond that, and mentally you have pretty much taken yourself out the game, mentally addressing it with a therapist, and it's not hard to do because it's a thing called sexual anxiety, where y'all about to do it, but you're so anxious
because you think things may not work.
You don't know if it's going to work or not, and then end up taking yourself mentally out of the game. So that's something you want to address,
And when you are having those difficulties, ruling out chronic disease causing those difficulties, because like we said, erectile dissatisfaction and all of that can be caused by some of the chronic disease out there. So fixing that. And then once you figured all that out, well, hey, you may need some hormone balance. For men, testosterone replacement, and for women, testosterone replacement helps with sexual function, the desire, as well as the enjoyment. Sometimes the intimacy concerns are above and beyond just the hormonal balance, and they may require some intimacy services. So for like men with who are starting to notice, because 50% of men at 50 are going to notice some changes in their erectile satisfaction, meaning things don't work as well as they used to 5, 10, 15, 20 years ago. But there are some wonderful things out here that we can do, including hormone balance, but also, and also prevention screening, making sure we're treating all of those chronic diseases, seeing your urologist, making sure your prostate and all of that stuff is good, ruling out chronic disease, cancer, and all of that. And once that's done, Then hormone balance, checking your testosterone levels. For women, I'll talk on women and Joseph can talk on men. So for women, once you ruled all that stuff out, you start treating the vaginal tissue so that you don't have the dryness. You want to think about hormone balance. Once you're hormonally balanced with your testosterone replacement that comes in a pellet form or a cream form, the next thing you think about is, do I need some help with my actual organs, and do I need an O shot to help with lubrication, sensitivity, tightening, leakage of urine, improvement in sensitivity and enjoyment, increasing the intensity and frequency of the big O. Doing the O wave or the hydrogel along with the O shot. So there are some great intimacy options for women, including hormone balance, but sometimes hormone balance alone won't fix all the intimacy concerns that women may have. And what would you say to men, Joseph, who are now 50 and starting to notice some changes?
I would say to men, we have the P shot, the P wave, same products for women, and hydrogel and things like that, which is all of those can increase blood flow, also can increase stiffness,
sensitivity.
And sensitivity. But I would say this: if you're not as healthy as you possibly can be, that is a short-term fix.
Right. That's right.
You're still not going to get the performance that you expect to get.
Yeah.
And all treatments are not the same for everybody.
Mm-hmm.
Perfect example is a person like myself. I can do the P shot with the hydrogel and probably not have to do any P waves for a year and be okay. That's not everybody.
Yeah, 65-year-old man.
Yeah, some people are going to have to do, even a 50-year-old man.
Yeah.
Some people are going to have to do the P shot and the hydrogel and do P waves and be on a steady regimen until we can get them where we need them to be.
Yeah.
But one of the key things that we have not talked about, and we're going to hit on it very briefly right now. One of the key things we have not talked about is a lot of blood flow has to do with our lack of water too.
Mm-hmm.
The fact that we don't hydrate. And now our body has water. Hydration is something that we need, but the lack of 100 ounces a day can also affect your blood flow.
That's right.
And I'm saying 100 ounces a day for people who are over 200 pounds,
right.
But half your weight, if you're 150, we're talking about 75 ounces of water. So the lack of water can also affect your blood flow, and it can also affect your health.
Mm-hmm.
So a person 54 years old doing a P shot with hydrogel, P waves, testosterone. I'm just going to stay on the intimacy stuff right now. The intimacy stuff, if you're not at least attempting to be as healthy as possible, those are going to be short term, and you're going to say, this product is not working for me. Mm-hmm. And the truth of the matter, you're not working for yourself. Mm-hmm. You just can't come in here and say, I'm going to do this. It's the same thing as taking a Blue Chew or one of those other things. Those are quick fixes, not a long-term fix towards the long-term problem. Mm-hmm. Because the long-term problem can put you in a casket. Mm-hmm. Let me put it plain. You can get diabetes, still get diabetes if you're not being healthy. You can still have heart disease. You can still have chronic other diseases. Blood pressure can still be extremely high. Mm-hmm. And you taking the pills and doing everything else and doing everything. You have good erections today, but eventually it's going to catch up. Mm-hmm. And whatever you do is not going to work. So you have to still mind your weight, be as healthy as possible, eat healthier foods.
Healthy lifestyle.
Yeah, have a healthy lifestyle. Don't eat a lot of fast food.
Right. And then a lot of the people that we see as they're older and more mature and they're still intimately, physically involved, you know what I mean? They're still having great intimacy with their partner and they're over 60, 70. Those people are healthy. They exercise all the time. They eat healthy. If they do have like diabetes or high blood pressure, it's very controlled. Their numbers look good. They're doing their part to live this healthy lifestyle. So that's the bottom line. Like if you want to have, like our motto is like real. You have to live well if you want to age well So you can have everlasting intimacy. You can't have everlasting intimacy without the living well, and you can't age well if you're not doing what you need to do to have a healthy lifestyle to live well. So we always want to make sure you understand the importance, and then it's a combination of things. You know what I mean? A lot of my ladies will come in, they feel like they feel pretty good as far as their testosterone levels. Their testosterone levels are low. I do an O shot. Well, testosterone also helps with sensitivity and enjoyment for women. It helps with clitoral stimulation and everything. So doing the O shot but not taking the testosterone, you're not going to get the best benefit. Doing the testosterone pellets and the O shot but not managing your weight and exercising and eating healthy and doing your total wellness and having the energy to exercise and, you know, all of those things, nothing is going to work. It requires a combination of different behaviors and lifestyle changes so that you can truly live a healthy lifestyle, so that you can, you know, age well because you're living well and you can experience intimacy. And intimacy, in order to do that, it may require a lot of help, and we're willing to, you know, get the help. And I think what separates me, Bella, from a lot of practices is that we look at the overall person and your overall health. So when you come in for weight management, I'm still going to look at your hormone levels. I'm going to look at all of your other levels. We're going to balance your vitamin levels. We're going to figure out what your particular lifestyle is, what your concerns and problems and obstacles are, so that we can figure out how to fix them and create a specific lifestyle that's going to work specifically for you, which may include hormone balance, you know, weight management, the intimacy services, and the prevention and screening. Everybody will require that component of it. So it's a whole lifestyle, like to like have this great life where you have great relationships and great intimacy till you die. That requires a lot of work on our end. What else?
No, that's it. Thank y'all for joining us. Again, this is Ageless Intimacy, and we're talking about weight management and intimacy, how weight affects your intimacy, and also you know, hormones and things like that, and how that also can affect it. The key to the key things you take anything away from today: watch your weight. If you have any symptoms of any illnesses, go to the doctor. If you're having any symptoms of low blood flow or erectile dissatisfaction, or lack for women, lack of sensitivity, no big O's, go see your gynecologist. If your gynecologist doesn't treat you for that, go see a specialist like us here at Me Bella, and we can do a full workup on you and see exactly what you need. You may not need hormones, but you might need the O shot and the O wave. Younger people may not need hormones, but because of the food that we're eating, it's still in our hormones. So we've seen younger people, not in their 50s, not in their 40s, not in their 60s, who do need hormones. So, you know, you need to get that checked out. Testosterone is a huge part of lifestyle, a huge part of being a human, male or female. You have testosterone. Women don't have as much as men, but you have to check it out because it's a forgotten hormone for women. So go to the doctor.
Anti-aging hormone.
If you're 200 pounds in high school, you should be around at 50 years old, you know, unless you picked up weight intentionally, but it's muscle, you know, then you can kind of control that.
Or just look at your BMI. If your BMI is over 25 to 27 for women and over 27 to 29 for men, then weight management is probably going to help your total wellness and your health. And exercise helps with the physical act of intimacy. So you need to stretch regularly so that you can be flexible. Like you can't stop exercising. Yeah, you can't stop exercising and think that you're going to be able to move.
Can be intimate without blood flow.
Yeah, you can. And flexibility,
impossible.
And flexibility helps a lot with the enjoyment of intimacy. If you can barely move your leg because you don't exercise or, you know, do anything with stretching, it's going to make intimacy more difficult for you as well. So all the things, just that total wellness, doing all the things you can do to live your best life. So it's Dr. Mia and Joseph. We're super excited about our intimacy event coming up on March 15th. Stay tuned. Our tickets will go on sale this week. So get ready to purchase your tickets while they last. It's definitely going to be limited because we want to keep it somewhat intimate, but it's going to be great for women. This is a female event only this time, but our next event will also include men, women, and couples. But for March 15th, it's going to be all women, single, married, women over the age of 35. A few may be under that age if they're already having some of these concerns, but learning all about intimacy, total wellness, and living a life of total wellness. So it's Dr. Mia. I'll see y'all soon, and I'll keep you posted. Thank you for joining us for Ageless Intimacy with Dr. Mia and Joseph. We'll see you next time. Bye.